Now it's time to feed your baby. You've primed your extension tubing. You've assembled your equipment. You've removed your feeding bag from the refrigerator, or in the case of the first feeding of the day, you've taken a new bag. You've prepared your feeding and brought it to the feeding area. The next thing you will do is fill your feeding bag, open the top, pour the feeding into it, making sure that the feeding container does not touch the top of the bag. Close the feeding bag securely. Place it on your IV pole. In many cases, the pump that you're going to use for your feeding will not have a priming mechanism, so you would make certain that you open the clamp on your feeding, remove the cap from the tubing, and prime your tubing, making sure that all the air bubbles are out and the tubing is filled with feeding. The next step, of course, would be to attach the tubing to the extension tubing. Then you will work with your pump. You will open your pump. Now, pumps will vary. Each pump will have a different way of loading, unloading, priming. Place your tubing into the pump. And turn the pump on and set your dosage using the appropriate buttons and the appropriate numbers. When your pump is ready, make sure that your tubing is unclamped. Turn on your pump, hit run, and your feeding will infuse into the baby.